Okay, everybody, this is my audience. This is my second recording because I did my speech already and my daughter forgot to record.
I'm the one that forgot to record.
And that's Kelly. Okay, thank you guys for coming again. I'm going to inform you again on the different types of birth control. Imagine you are 16 or 45 and you take a pregnancy test and it comes out positive. Did you know about the different types of birth control, or did you think it wouldn't happen to you? I know. I was 19 when I first had my kid, and I was taking birth control pills, and I thought if I missed one or two, it wouldn't make a difference, but it did. My mother, who's also 16, didn't know about any of the different types of birth control, so she got pregnant as well when she was young. According to Women's Health, 53% of all unplanned pregnancies occur in women using contraceptives. We recognize birth control as a form to prevent pregnancy. Today I will be informing you on what birth control is, the different types of birth control, how they are placed or taken, and the effectiveness on them. I want to explain what birth control is and also the different types. Birth control is used to prevent pregnancies according to Family Doctor, and according to Women's Health, birth control has proven to reduce the number of pregnancies if used effectively. According to Donna Theobald from assortment.com, a little bit of history on birth control, that is, in 1562, the first birth control was the condom, and it was made of cloth linen or animal intestines. You wouldn't think that there were so many options out there or any form of birth control. According to Dr. Stoppler, there are many different types of birth control, and these birth controls are barrier, mechanical, hormonal, natural, permanent, and emergency. Barrier methods include the cervical cap, the condom, and the sponge. Mechanical birth control is the intrauterine device. The hormonal method means that it has estrogen or progesterone in them, and this includes the birth control pill, the patch, the NuvaRing, the Noriplant, and the Depo-Provera. Natural methods are fertility awareness, symptothermal, ovulation testing, withdrawal, and abstinence. Permanent methods are tubal ligation, vasectomy, and sterilization. In an emergency, you would take the morning after pill. Since we know what birth control is, let's look at the different methods and how they are used in place, how they are taken. Oral contraceptives are taken orally every day, usually around the same time, to be the most effective. The patch is placed on the skin and worn for 3 weeks and taken off on the 4th week and repeated every month. The ring, the sponge, and the cervical cap are inserted into the vagina, and the ring is worn for 3 weeks, taken out on the 4th week, and is effective for up to 3 hours if taken out. And the other 3 are taken out after sexual intercourse. Samantha, stop. The Depo shot is a shot you get at your doctor's office. It's intramuscular and it is good for up to 3 months and repeated every 3 months. Noriplant is placed in the upper arm with a small incision. You can barely see it underneath your skin, and it is good for up to 5 years but can be taken out within the 5 years. The intrauterine device is placed inside the cervix. It's a small T-shaped item, and it is good for up to 5 years as well, and can be taken out sooner than that too. Tubal ligation and vasectomy are a simple surgery done in the doctor's office for people that do not want to have any more children, but can be reversed at a costly price. Emergency pill has to be taken within 72 hours after sexual intercourse. Natural methods include taking an ovulation test, which you can buy at any pharmacy, checking your temperature, knowing when you ovulate, some women know when they cramp up, and withdrawal from the woman. Now that we know what birth control is, the different types of birth control, how they are taken or placed, let's look at the effectiveness of them. The effectiveness depends on how it is taken, if it is exactly taken as prescribed. No method is 100% effective. The only method that is 100% effective is abstinence, and none of these birth controls are 100% effective against sexually transmitted diseases. In conclusion, everyone should know what birth control is from young to old, and I hope that everyone takes some of this information with them and shares it with whoever needs to know. Remember that there are many different types of birth controls out there, different ways to take and be placed, and also different effectiveness on these. So maybe in the future there can be more planned pregnancies. Thank you for your time, everybody. Have a nice night.